give us a clear picture of what exactly happens once one's colon is affected by this cancer, you know?
So once we diagnose the colon cancer, the treatment will depend upon which part of the colon is affected, because the colon is quite a large organ. So you can divide it into colon on one side and rectum on the other side, because the treatments will differ slightly. Patients with colon cancer, the most important treatment is surgery. And the surgery also helps us to understand about the biology of the tumor. Remember, you can have colon cancer, but the behavior of that colon cancer may not be similar to that of somebody else. And we are now learning through a lot of detailed tests that people's treatments can also be different, and we can give you targeted treatment for your specific cancer depending on how it behaves. People with colon, with cancer of the rectum, will have radiation treatment embedded into part of their treatment journey. And usually after surgery, depending on how far the cancer had it gone into some nearby lymph nodes, then most patients who have that will then be given chemotherapy for 3 to 6 months thereafter. And most patients will be cured by that alone. And we have evidence here. She's been she's been cancer-free since when now?
2012.
From 2012. You know, and this treatment has taken place in Kenya. You know, she didn't have to go to another country for treatment. And people are surviving colon cancer for very many years after that. So I think it's a good thing that we're doing for our people.
Yeah, and still staying with the treatment options for colon cancer, the surgery. We know at the end of the day the surgery will be involved. Once she was talking about her colon being cut. Maybe now you could now tell us what exactly happens once the colon is cut. We know the function of the colon. What next for this patient?
I'm not a surgeon, but I'll speak for them, the little that I know. So the colon is huge. You know, you can remove half the colon and your function will not be changed significantly. What really matters is which part of the colon is affected. And in Sally's case, in the rectum, because it's very low down, then it's very difficult to have a good reconnection. So you find that sometimes they might remove part of your intestines to come out in the belly, and then you have a stomach bag. We call it a stomach bag to be collecting the stool. So your stool doesn't go down the normal way into the bottom opening. So that's usually the tricky part. But people who have colon cancer on the right side of the body, they just have surgery and they have the reconnection and they just resume, you know, normal function thereafter. And even now we are getting very advanced in how we do these surgeries, and now we are doing the colon resection using keyhole surgery. So you don't have a big, you know, giant cut through your abdomen. We just do it through the keyhole surgery using the machines and all those, almost like a robot or some special hands. So we are able to dissect and remove the tumor without leaving you with a big, bug, ugly scar. And you heal much quicker. You know, you get to start your chemo much faster, and you get to finish your treatment much better. So it really depends on your specific surgeon and having discussions around how your bowel will function after that. But the major issue is actually having that stomach bag after surgery for some of the patients.
For some of the patients, but you've clearly said that not all of the patients that can be forced to use the stomach bag. That's what you're trying to say?
Not really forced, but depending on the location of your tumor, you may not need to have
the stomach bag.
Yeah.
But I think for Sally's case is different. You're using the stomach bag. Yeah, maybe you can quickly talk about it.
So again, coming to the issue of the stoma, it was very traumatizing again, because you know, I was going through surgery and all these treatments. So it came a time that I was told, don't worry. I was in a lot of pain and I wasn't eating and there was too much pain in my abdomen. So I walk into the doctor's room, and we had gotten used to each other because I was visiting him like after every 2 weeks or 3 weeks. So he tells me, Sally, don't worry. I give you a colostomy and you'll be fine. So if I asked you today, Purity, what is colostomy? Would you know? For a lay person. So I thought that was going to be the wonder drug that would take away this pain that I'm having. But he says, this one, we have to do it in theater. And I'm like, theater? Yes, because it's a procedure. Then he books theater as usual, because I'd gone to theater many times. So it was just one of those days I was going to theater again. That was in 2010, March. So we go into theater, then I come out, and then when I wake up, of course, from the anesthesia, I'm told, I find a nurse and she tells me, my dear, you need to change that bag. I was like, bag? I thought when I was going into theater, my bags went home. So what is this bag you're talking about?
Yeah.
And she kept on pointing at me.
Yeah,
that
stomach,
bag, you need to change that. So I looked at my, on the
Was it on
side
the
where
right
she was
side or
pointing,
on the left? On the
I
left
looked
side.
at what she was pointing and I saw something pink, scary, and it was covered with some kind of like polythene, something. I was so traumatized. And I thought, how could the doctor do this? We go into theater, he cuts me and then he leaves me open. How could he do this and what is this bag? So I asked this nurse, okay, I may not understand what you are telling me, but I'm asking you, could you help me to remove this bag that you're talking about? I realized that now the bag she was talking about was what was there. And she tells me, my dear, I'm sorry, I can't do that to you. What you're asking me is equivalent to, let's go to the loo, carry this tissue with you and help me. I said, it could sound that way, but take me as a baby. You've put diapers on me. How do I remove it? You have to show me how to do it until when I'll be grown and then I know how to do it. And then she just walked away and said in Swahili, utajipanga. And she left me there. And I cried. And as I told you, from HIV, I'm an activist.
Okay.
So day 1, day 2, the doctor comes for his rounds.
Nothing is
Nothing.
happening.
The bag is still there. I'm still being told to throw a bag. What bag? And I'm traumatized, and I don't understand why this intestine was left hanging outside. You know, the intestine is pink and very scary. You can imagine something that's supposed to be internal is external.
Yeah.
I've never seen anything like this. So day 8, I told my doctor, you just come here and you're laughing at me. Today, I'll walk on this corridor naked. If someone doesn't sort me out, today I'll walk out of this bed and just walk on the corridor. And then a nurse comes and now a male nurse comes and tells
That's
me.
8 days?
8 days
Yeah,
with the
the
bag.
bag.
Of course, I wasn't eating, so there was
Yeah.
nothing much coming out,
Okay.
just the mucus and some little stool. So a male nurse comes and tells me, my dear, don't worry, this is very normal. I said, what do you mean normal? And my intestine is hanging outside. And it was huge. And he tells me, it is fine. Remember when you were going into theater, the doctor said colostomy. Then I remembered, yes, he said colostomy. But to me, it was a drug that was going to take away the pain that I had. And he said, no, it's not that. Remember also after you did colonoscopy, they found tumor on the colon going downwards to the rectum. So it started taking me step by step. I said, yes, I can remember the results, and that is what happened. And do you remember you asking the doctor that what will happen to you passing stool? I said, yes, I remember. So now this is what has happened. It has been, the wave of your stool has been diverted. And because the rectum has been taken off, the anus has been taken off, so how do you pass stool? And that is why the surgeon has created a hole through your body to pass the stool. And that is what is called a colostomy.
Right.
So, and this is the intestine that has been brought out and it has been sewn on top of the body. And now it's your new hole for passage of stool. And you have to use this special bag called a stoma bag.
Yeah.
Okay, so I started understanding. But I was very bitter
Yeah.
and angry because after being taken through all this trauma, someone should have just told me that. I was very bitter with my doctor. Now we have reconciled and we are now friends.
Okay.
But I was wondering, he couldn't tell me this from the beginning. Maybe it could have been different. And that is why I do what I'm doing.
Yeah, right now.
I'm talking and telling people that it's normal to...
And it has now become your lifestyle, Sally?
And it will be forever.